Good evening. For a nation with 160 million children of less than 6 years of age, the task of reaching out to them is bound to be Herculean. However, after years of neglecting the need for a dynamic policy vis-à-vis childcare and education, the Women and Child Development Ministry, WCD, has revised the National Policy for Children for the first time since it was adopted in 1974. And the revised draft has been put in the public domain, inviting views before it is finalized. The revised draft policy defines any individual below the age of 18 years as a child. According to the draft policy, a multi-dimensional, integrated and inclusive approach is necessary for the overall and harmonious development and protection of children, which acknowledges their heterogeneity and different needs. The National Early Childhood Care and Education ECCE policy reaffirms the commitment of the Government of India to provide integrated services for holistic development of all children along the continuum from the prenatal period to 6 years of age. The policy lays down the way forward for a comprehensive approach towards ensuring a sound foundation with focus on early learning for every Indian child. Tonight on The Big Picture, we discuss the revised draft itself, its salient features, and more importantly, the feasibility of the goals outlined in the new draft. And joining me in the studio tonight to help us understand the challenges, it's Thomas Chandy, CEO of Save the Children, Ambarish, National Convener, Right to Education Forum. Also joining us will be Dr. Alex George, Knowledge Hub Leader on Child Rights for ActionAid India. Welcome to the show, gentlemen. I'd like to start with Thomas Chandy, if I could. Thomas, you worked extensively with children, especially the underprivileged and the disadvantaged. Before we start discussing the policy itself, I want to get a sense of what the condition of childcare in India really is. How far behind are we really from countries with similar challenges, say Brazil or China?
Well, if you look at the Child Development Index, that is a research work that has been done by Save the Children and which was published last month. India is actually, if you look at from 2000 till now, India has slipped 12 points. And that is, and it is very close to the bottom of the list. So which is not so great as far as India's status is concerned on various issues of children, be it the nutritional status of children, be it, well, we have improved on the enrollment of education. There are less number of children out of school now, but that is just the access. But in terms of quality, we have not really achieved much. India has the largest population of child labor. We are not even sure about the numbers because there is a government number which talks about less than 10 million. There is a UNICEF number which is 28 million children involved in various kinds of labor.
There is no conclusive number that we can actually put together as a yardstick.
Sorry?
There is no conclusive number that we can all agree on.
There's no conclusive number, but we know that India, definitely because of the highest population of children in India, is more than 400 million children. Definitely the issues relating to children are also very high, and the numbers of child labor, we know that we have a large population of children because of some of the policies of the government itself, by the definition of child labor, by the defining who a child is. At least in the new policy,
they told us what a child is. Anyone below the year of age of 18 is a child.
Which is good because earlier there was no definition. We only know by certain acts that below 14 this is not allowed, but they are not really clearly defined who a child is. But now below 18, this new policy applies, which is a good.
Right,
I think
fair point. We take the point. We are far behind countries like Brazil and China. We'll talk about that also.
You also talked about China. The difference between China and India, if you really look at the Child Development Index, is that China is among the first 5 countries in terms of the Child Development Index. Human Development Index, China is not that high. So what is the difference between India and China? Why is India on the bottom of the list? I think it's simply the investment in children. China has made it a priority to invest in their children. So they are way above. And that
India
is not
needs
been
to
the
do the
case.
same right now.
Sorry?
India needs to do the same, invest in their children. Fair point. We take your point, sir. We'll go to Dr. Alex George for a second now, sir, and ask you this. What does it say about our attitude, and by we, I mean our government, us, everyone in India, about our attitude towards children or child care in the country, that the national policy for child care was revised for the first time since 1974, since it came into being. Why did it take us over 3 decades, Alex, to give this important issue the attention it deserves?
Well, actually, if you look at the National Child Policy of 1974, I had a look at it. It's only about 5 or 6 pages document. It's not the length of it what I'm talking about, but even the depth of the matter that it contains itself is of a very rudimentary kind of nature. And
Boilerplate.
it does not really talk about many concrete aspects, many concrete details, many concrete goals, targets, etc. Whereas if you look at, say, the National Health Policy 2002, there are clear-cut goals, targets, etc., which are mentioned, which are outlined over there. Now, when you come to this policy also, I would say that it is a kind of extension of the National Child Policy of 1974. Here also you have a policy which does not clearly outline what are the goals which we are trying to achieve, what are the targets, what are the timelines within which we will achieve these targets. These kinds of issues are not addressed at all.
Right.
And of course, as Thomas Chandy was telling, we do welcome the fact that child is defined as any person under 18. But at the same time, this has to be carried across all the laws which apply to children. And that kind of a commitment clause is not at all included in this draft. So that way the draft has got a number of lacuna which still needs to be revised.
I think the positive thing here is that they've invited public opinion as well. They've invited all kinds of suggestions as well. We'll get to that in just a bit. I want to get
But just to
Ambarish.
add one more point, even the public comments which are invited are also invited up to the 5th. And you have a draft which has got several lacuna in it.
Right. We will discuss the lacuna that you talked about and suggestions as well, but a little later in the show. I want to get Ambarish in the conversation as well. ICDS, that is the Integrated Child Development Scheme. Now, the 5th 5-year plan saw ICDS being implemented. It started out with 33 projects in 1975. Today, the scheme, the ICDS scheme covers about 2.22 crore in about 3,926 operational ICDS projects. How effective, according to you, Ambarish, has the ICDS been in reaching out to the targeted population, that is, affected children?
You see, there is so many reports reviewing this ICDS program. This is the largest program for the children in our country. But we have seen that ICDS is totally failed, and we need to revive it. And this is a scheme for children. We want a right for the children. We want a right for 0 to 18-year age of children. And ICDS is inadequate. Education part is missing. And not only education part, nutrition also missing. You know, 40% of children below 6-year age, they are malnourished in this country. And you have no any access and no fund, no allocation for the ICDS properly. So ICDS is not a adequate and sufficient scheme for the children.
So you're saying the ICDS, while started as a scheme, doesn't really fit in because we don't need a scheme, we need a proper concrete policy.
Yes, we need a right perspective for the children. And this policy, this children policy is not being made under the right perspective. So we want a right perspective. Children have a right. You are making a policy for 40% of population of this country. Children are 40% of this population.
Right. Fair point. Ambarish, we'll take a small break right now. When we come back from the break, I want to talk about the policy itself and the goals it outlines. Don't go anywhere, keep watching The Big Picture. We're discussing the National Childcare Policy that's been revised and is open to public suggestions. Don't go anywhere, come back. Welcome back. You're still watching The Big Picture and we're discussing the National Childcare Policy. Thomas Chandy, I'd like to ask you this. First of all, let me quote a few lines from the policy. The draft policy acknowledges that work that the private sector or NGOs are doing in the field of childcare and says, and I quote, the private sector in an organized or unorganized form with varied quality is perhaps the second largest service provider of ECCE, and its outreach is steadily percolating even into rural areas across the country. It also adds that there is a need to harmonize the activity of all these service providers in accordance with program mandates, standards and legislations. My question to you is, how far has the private sector been able to harmonize and synergize with the government agencies on this? Your take on that?
Now you're talking about the early childhood policy, not about the national.
Not the whole policy, but this is what it says about the ECCE.
Yeah, it is from the ECCE. Well, my take on this is that the integration between the private sector and the public sector, or private sector and the government sector, has not been that great. I mean, I think it's going parallelly in one sense. But if you say that the private sector is reaching out to large numbers of children, and when we are talking about large numbers of children, I'm talking about the most marginalized children here. I think the quality is greatly suspect, and the poor people think that if it is private education, it adds value. But if you actually look at the delivery by the private in the rural areas, in many places, that has not been the case. We as an organization we believe that government is, in that age group, government should be the primary service provider, and we should be supporting the government systems and help the government systems, making sure that, that there are adequate teachers, there are proper training for the teachers, and the facilities of the and the infrastructure of the schools improve, and that would be better than just, there is definitely
some sort of a synergy, but not enough.
Absolutely. There is, I don't think there is enough synergy between private and public.
Right. Alex, George, let me ask you this. As per the policy draft, and every child has a right to safeguard against hunger, deprivation, malnutrition. The state would like to commit to securing the right through access, provision, promotion and required services and supports for holistic nurturing. This is part of the policy that I'm reading from. Noble words indeed, even nobler intentions. But as someone who knows about the ground reality in childcare services in the country, are these just lofty goals or that we have set for ourselves with little or no hope that these policy initiatives, prescriptions will ever be implemented? Or do you think I'm just being overly pessimistic about it?
I don't think you are too pessimistic about it, because you see, even when they are saying these lofty words, as you say, they're not attaching any numbers to it. They're not saying that how many children in this country will be provided nutrition, by what percentage they will reduce the reduce malnourishment. As Ambarish was telling, we are a country where 45% of the children are malnourished according to NFHS 2006, and also according to a recent study called the Hangama study, which was conducted by an organization in Hyderabad called the Nandi Foundation, which was conducted in various states of the country. So there is no great improvement in malnutrition even after 2006 according to the Hangama study. So, but what is the national policy draft committing on? There is no commitment in terms of reduction of numbers, like this much percentage of numbers will be reduced or anything of that sort. It's not committing. So that being the case, I don't think it is a very serious, firm stand from the part of the government at all.
That's a fair point, sir. We will talk about that a bit more as well. I want to get Ambarish in as well. Before the show, we were talking about how displacement is a big issue. We were also talking about children who are affected by sectarian violence, natural disaster, and what have you. My question, of course, is there is no dearth of any of those things in the country. There are riots all over the place, the natural disasters happening as well. But we have cases of children affected by violence and disasters that happened years ago. But they still live in despicable conditions with absolutely no source of income to support themselves. Forget income, no access to running water, living shelters for that matter. Is this policy, according to you, just providing lip service? Because like Alex mentioned, there are no numbers to talk about per se.
This policy is very weak. You know, the 3/4 children are living in the conflict areas, migrant children, street children, as you said, affected by the communal violences.
Right.
And they are belonging to the excluded communities, and they are belonging to those who are not able to earn 20 rupees per day for their livelihood. The most of the children belonging them, and this policies fail to address those children and to fulfill the interest of those children. You see, there is a issue of survival, there is a issue of malnutrition, there is a issue of rehabilitation, and child labor. Regarding child labor, there is no commitment in this policy. The policy is not talking about their target, any target for the abolition of child labor. There is no any, and they are not mentioning RT Act even in this policy. You know, in 68, Kothari Commission has recommended equitable and quality education through the national system of public education, through the common school system. They are not going towards to achieve that goal. You know, inequality in this exists in the education, and there is no any target and no any instrumental measures to make equity in education for all children.
Fair point. Point taken. Do you agree with that, Alex? There is no concrete policy prescription in this policy that people can look at and perhaps try and implement.
And what Ambarish was talking about that there is no concrete policy prescription with regard to the excluded groups of children. Actually, that is a major lacuna of this, another major lacuna of this draft. Because the draft is talking widely about disadvantaged groups. This is the term which the draft is using. And it is not even mentioning the well-known excluded groups in the country, like the scheduled castes and scheduled tribes, Muslims, even girl children. All these issues are not at all dealt with. And it does not have a clear gender perspective, which actually should come upfront in the preamble and then run through all the various subsections of the document. It's not mentioning like that. It is additionally it is mentioning, bringing in the gender perspective. No, that is very inadequate.
Right.
Because if that is the case, then gender may not even be addressed in that manner. Gender is an issue which has to get mainstream throughout. And I would additionally like to say that ActionAid is working among various excluded groups of children in this country, like the Dalits, the tribals, and the Muslim children in various states of the country. So we have the experience in the education of Muslim children, in the education of Dalit children, and in the education of tribal children in various far-reach remote countries, remote territory, remote areas of the country.
Fair point. Your take on this, Thomas, do you agree with these two gentlemen saying that your first
Well, I have a slightly
please go ahead.
slightly different take on this. I think as a start document or a draft document, and considering the fact that almost 40 years have gone by between 1974 and now and when this policy would be effective, I think that there has been a genuine good attempt to capture the child rights perspective, which was lacking before. So I think that's a great improvement in itself. There has been a great attempt to involve many people, and it's been a good consultative process. And as I said earlier, below 18 years old has been taken. And when we look at any policy, I mean, this is a national policy. I don't think a national policy of this kind would be able to set out exact numbers and details on a target and a plan.
In its first draft.
In its first draft. And maybe in the policy itself. I think what should follow this, and I'm sure that is what we hope, that there would be a concrete plan that would say, and as Alex said, that it talks about disadvantaged group in an overarching way. But you have to say in the disadvantaged groups who are the most marginalized. What about those children who are displaced due to conflict? What about these very obvious groups, scheduled caste, tribes, Muslims, and so on? And these numbers, etc., will then be a part of the plan which should follow from this. But as a first draft is concerned, I think it's a good starting document.
Right. You have a point to make, sir. After that, we'll go into a break.
Yeah, I would like to intervene at this point and say that this is not a first draft. This is a draft which according to the WCD ministry itself, has gone through various consultations, and Thomas was also saying that it has gone through various consultations. And the ministry talks in particular about 4 zonal consultations which it conducted. And this is a draft which has this is a fairly evolved draft on which the ministry is now inviting comments only up to the 5th, which means it is going to close on that. And after that, even if the ministry is coming out with the final draft on the 6th, we may not be able to do anything. So that way, this is the time to question the draft.
Right.
And
No, I
we
agree
cannot
that,
we cannot pull back from that.
Yeah, the time period given is
far
2
too
weeks.
short. It's
We
far
would,
too
we would
short.
at least like a month or 2 months
And
for something.
Also, I want to add one more point to what Thomas was telling. That he was saying that this is addressing the child rights perspective. Now, if it is really addressing the child rights perspective, now any rights framework also involves in it a governance approach. And in the governance approach, it is not even giving the governance approach anywhere. It is not telling as to how this draft policy will be implemented, because this is a policy which has to be implemented across various ministries. And within the ministry itself, there are various departments it will have to go through. So all these coordination mechanisms, operational mechanisms, monitoring mechanisms have not been spelled.
Alex, hold that thought. We'll take a small break, and after that, we'll do exactly what the ministry wants people to do. We'll give them suggestions. I have 3 experts in my studio. We'll see what my panel of experts come up with in terms of suggestions and in terms of lacunae, like my guest mentioned. Perhaps we can help give our opinions as well. That's after the break. Don't go anywhere. Keep watching The Big Picture. Welcome back. You're still watching The Big Picture. Now, the Women and Child Development Ministry has asked for suggestions and comments. In fact, has invited civil society as well to participate in the framing of the final draft. I can't think of a better platform than The Big Picture on RSTV to suggest ways that we can help improve the draft. One by one, I'll go across my panel. Suggestions for the ministry. You've read the draft as well. How can we make sure that India's children do not get their constitutional rights to a decent childhood trampled on? Your suggestion first, Sir Thomas.
Okay. First of all, as I said before, increase the time period to give inputs. August 5th is too short a period. 2, the draft does not, though it defines child as somebody below 18, it's completely absent for the age group between 14 and 18, because earlier there was a definition of below 14 as child through some other acts. But between 14 and 18, there is clearly no plan, no policy. And in terms of coordination mechanism, they are suggesting another group called NACG. My recommendation is that there is no need for another apex body to monitor. There is already the NCPCR, which is there, the National Commission on the Protection on Child Rights. Make it stronger, and so we don't need to have one more addition. Then 4th thing is that Alex had mentioned it, there is no budgetary provision in this. The current allocation for children is far too less. I think it's only 4.2% of the GDP goes for children's issue. That is far too less. So budgetary allocations have to increase. And my final point is that the ministry itself should be strengthened. It's only a ministry of state, a minister of state that we have for 70% of the population, children and women. And I think there should be a union minister who would be running this.
Point taken.
Yeah.
Alex, let me come to you. Your suggestions for the ministry for the draft?
My suggestion would be that the draft has got a number of lacunae. I have already discussed
Outlined those.
A couple of those. And to start with, we welcome the fact that the under 18 is defined as the child. but then this is something which has to be carried across the spectrum and amend all the relevant laws and incorporate it into the various policies of the government. Now, this was mentioned by the 11th plan draft with regard to implementation. It is not done so far. And then I would suggest that there has to be more concrete and measurable goals and targets. And there are other policies in the ministry, in the government sector itself to look up, like the health policy and all that. And then there has to be operational mechanisms for implementation of this policy, both within the WCD ministry and for coordination with outside other ministries.
Right.
And NCPCR, being an ombudsman for children, has got a major role to play in this.
Point taken, Alex. I'll come to very quickly to Ambarish. Your suggestion, and then we wrap the show.
Okay, my suggestion is this: to establish the authority, status and force for this child policy. Parliament should adopt this policy. WCD ministry should place this to the Parliament, and Parliament should own this child policy first. Second, commitment for child labor, abolition of child labor. There is no ban on child labor. We must include that banning of child labor in this country.
Right.
Third is, there should be a concrete policy for implementation of RT Act and beyond RT Act to make equitable and quality education for all children.
Fair point.
National system of public education should be established through the common school system, and so many committees and education policy, they made such type of recommendation, and 68th Commission has recommended for
That's it. We have to end the show now. I have to interrupt you. We are out of time. I'm so sorry. We have to end the show right now. There you go.
Okay.
I hope the powers that be are watching right now. We've got some concrete suggestions from a panel of experts, of course, who worked extensively in the sector. That's all the time we have on The Big Picture tonight. Till next time when we get you another edition of The Big Picture with another hot issue, another hot topic. Athar Khan saying goodbye, good night, and thank you for watching.